Pain between the shoulder blades often occurs as a result of trigger points forming in the major and minor rhomboid muscles. In this video, we will take a detailed look at the locations of trigger points, exercises that can help relieve pain at home, as well as useful recommendations to prevent the recurrence of discomfort. This is Dr. Chernov. Let's get to the bottom of this pain. The major and minor rhomboid muscles are located in the upper back just below the trapezius muscle. The minor rhomboid muscle, which is closer to the head and smaller in size, attaches at the top to the spinous processes of the 7th cervical and 1st thoracic vertebrae, and at the bottom to the inner edge of the scapula at its axis. The major rhomboid muscle is located below, attaching at the top to the spinous processes from the 2nd to the 5th thoracic vertebrae, and at the bottom to the inner edge of the scapula from its axis to the lower angle. Trigger points in the major and minor rhomboid muscles cause pain along the inner edge of the scapula, between the scapula and the spine, and in some cases the pain radiates upwards over the supraspinous part of the scapula. The pain caused by trigger points in the rhomboid muscles is somewhat similar to the pain from trigger points in the levator scapulae muscle, but without the cervical component and restriction of neck rotation. Self-treatment involves pressure and stretching, but if the development of trigger points is due to prolonged stretching of the muscle, which is exactly what happens with the rhomboid muscles in cases of slouched posture and forward head position, then treatment in the early stages should avoid overstretching the rhomboid muscles. Instead, the focus should be on massage techniques, exercises to strengthen the back muscles, and restoring proper posture. You can self-treat the area of trigger points using a massage ball or double massage balls. If you don't have a special firm massage ball, a regular tennis ball will work just fine. Stand against the wall and roll the ball over the area between your shoulder blade and spine, slowly moving up and down. Once you find the painful area, stop there and press the ball against the trigger point for 30 to 60 seconds. After that, roll this area of your body up and down again and perform the exercise on the opposite side of your back. You can repeat this simple exercise several times throughout the day, especially if you spend long periods at the computer or driving. A similar exercise can be done using a large and small double massage ball. Stand against the wall and massage the area between your shoulder blades with the double ball. Once you find the painful spots, stop and press on them for another 30 to 60 seconds, then massage the muscles in that area again. The small double massage ball targets the part of the rhomboid muscles that is closer to the spine. The large double massage ball helps to massage the muscle areas closer to the edge of the scapula. If you don't have double massage balls, you can do the following. Take a sock, put one tennis ball in it first, and then tie the sock tightly. Put the second tennis ball in and tie the sock tightly again. You can significantly increase the mechanical pressure from the double massage ball by doing the same exercise on the floor. Press your body weight onto the double ball, cross your arms over your chest, and slowly move back and forth in the area between your shoulder blades. To further retract your shoulder blades and increase the mechanical pressure on the rhomboid muscles, grab your head with your hands and bring your elbows closer together. I personally love doing this exercise every time I work at the computer for a long time. The method described above for targeting the trigger points in the rhomboid muscles helps to quickly relieve discomfort. However, the key point in treating the rhomboid muscles is to restore proper posture as early as possible by eliminating the forward head position, as well as regularly performing exercises aimed at strengthening the interscapular muscles. The main function of the major and minor rhomboid muscles is to retract the shoulder blades. So, all the exercises that involve bringing the shoulder blades together will strengthen the rhomboid muscles. The simplest dynamic exercise for strengthening the rhomboid muscles is alternating scapular retraction and protraction. Inhale through your nose or mouth as you pull your arms back, and exhale as you return your arms to the starting position. You can work with both hands at the same time or alternate between your right and left hand. You can also intensify this exercise by holding something like a water bottle or a stick in your hands. If you have pain in your upper back, be sure to include this in your daily exercise routine, and also subscribe to my Telegram channel via the link in the description to stay updated on new health-related videos. Static exercises for the rhomboid muscles will help them become stronger and further improve your posture. Sit on the floor, bend your knees, and place your feet hip-width apart. Place your hands behind your back with your fingers pointing backward. On the inhale, lift your pelvis up, squeezing your shoulder blades as close together as possible. And with the exhale, hold this position for as long as you can. Don't tilt your head back too much. Stretch the crown of your head along the line of your spine. As your fitness level increases, hold this position for 1 to 3 minutes while maintaining calm and deep breathing. An even more intense static exercise that helps strengthen the rhomboid muscles and improve posture is the following. While on the floor, position your legs as in the previous exercise, turn your torso to the right, and place the palm of your right hand in the center along the spine. On the inhale, lift your pelvis up, look at your supporting hand, and on the exhale, stretch your left arm up or over your head. Hold this position for as long as you can, maintaining calm breathing. Return to the starting position, turn your torso to the left, using your left hand for support. On the inhale, lift your pelvis, and on the exhale, stretch your arm out and hold this final position for the same amount of time as you did on the first side. It's important to understand that pain between the shoulder blades can also arise from other muscles, such as trigger points in the Levator scapulae, Trapezius, or Infraspinatus muscles. So I recommend checking out the overview of these and other muscles in this playlist. Thank you for the like and subscription, stay healthy, and see you in the next videos.